what's happening in telemedicine and virtual care is that they're using technology and nurse practitioners and doctors who are working remotely to make sure that you can deliver world-class healthcare to people wherever they're at. And here are the results that they're getting. Stays in intensive care units are down 35%. Now that's a statistic, but what that's telling you is that, and as many of you know, those are some of the most expensive hospital bills, the stays in intensive care. The stays are down 35%. Fatalities are down 30%. Now again, that's a statistic, but those are lives. Lives that are being saved. People who are able to go home. And when I visited the telemedicine and virtual care center here in the state of Missouri, right, they told me that just the day before, they'd had a visit from folks from Israel, folks from UNC Chapel Hill, folks from the University of Pennsylvania to see what's happening in Missouri. And I said to them, how come we have this technology in the state of Missouri, but we're not able to use it to meet the needs of rural patients throughout the state of Missouri? And you know what they said to me? They said leadership. So we've got a governor who we can't get a meeting with. I said, yes, there's some complexity to this problem. There's a data sharing problem. There's a broadband issues that have to be addressed. We said, you put 8 quality people around the table together, we can figure out a way to do this. The fact is that there are quality solutions that exist, and they exist right here in the state of Missouri. And we need to grow those solutions. This is as opposed to Obamacare, right, which, as all of you know, is a broken program full of broken promises. You know, Obamacare, they promised you, they said, you can keep your doctor if you're like your doctor. That turned out to be false. They promised people their premiums would go down, and in fact, they've gone up. And in states where they've expanded Obamacare, they're actually breaking the bank. So we have to focus on the solutions that we have right here in the state of Missouri, and that's what I'm going to do as governor.